Hi, I'm Klimek, and here's my paper slides about PTSD treatment. Here in the United States, we often think we are superior to other countries when it comes to medicine, but are our methods really the best? That's what I'll be investigating through the PTSD treatment of the United States and in Egypt. So what is PTSD? Post-traumatic stress disorder is an anxiety disorder that develops after exposure to a traumatic event that evoked intense fear, horror, or helplessness. In the United States, psychotherapy is the dominant treatment method for PTSD with the use of cognitive behavioral therapy and prolonged exposure therapy. In Egypt, the approach to treatment is much different. They use a much more natural approach through relaxation and meditation to free the mind of the darkness and negativity that comes with PTSD. A new retreat recently opened in Egypt on the Nile River called Fekra, which provides healing methods such as yoga and meditation to treat PTSD. Recent violence in Egypt sparked a new wave of interest in treating PTSD, since it has become so common. The Nile sanctuaries are safe and haven-like to the patients attending them. Yoga and meditation by the river help to heal their PTSD through relaxation and rejuvenation in order to raise serotonin levels. The United States, however, accepts cognitive behavioral therapy as the most effective way to treat PTSD. In this method, therapists help patients to understand and change the negativity they associate with the events into something that they can move on from. Oftentimes, in patients with PTSD brought on by war, the patients feel an overwhelming sense of guilt for the violence, casualties, and death that occurred during the war. The therapy helps PTSD treat patients to cope with anger, guilt, and fear. One specific type of cognitive therapy that is used most often to treat PTSD in the United States is exposure therapy. This type of therapy involves talking to the therapist about the past event and learning to gain control of the emotions that the memories provoke. As time goes on, the patient becomes more comfortable talking about the situation and gains the ability to live a normal, healthy lifestyle once more. This is called desensitization, which is an important step in overcoming fears that are aroused by traumatic events. One of the main differences between Egyptian and American PTSD treatments is the use of medication. In the United States, psychiatrists rely heavily on medication in order to successfully treat patients. Selective serotonin reuptake inhibitors, a type of antidepressant, are often prescribed in the United States. These can help the patient to feel less sad or worried. When diagnosed with PTSD, the patient may have decreased levels of serotonin, which can be increased by taking SSRIs, overall making the patient happier and generally in a better mood all around. In Egypt, however, they avoid medication and try to stick to a more natural treatments for the mind and body, such as meditation and yoga. Although the Egyptian and American treatments are very different in methods, both of them have had successful outcomes. Everyone is different and needs a treatment shaped around their lifestyle, needs, and traumatic experience that they are trying to overcome.